Thank you so much, Dr. Avery, for being with us here today. You're the co-director of the Global Health Catalyst Summit.
Yes.
And we're here today in the context of the Symposium of Radiotherapy in Chile and Latin America about access, innovation, and the future of radiotherapy in a global scale. You will present to us today about the challenges that the United States presents in radiotherapy. Would you like to acknowledge the main things that maybe the people that aren't here would like to hear or know about your presentations?
Sure. Well, there's two presentations that I'm giving. The first presentation would be on some of the challenges with access to care. And I'll talk about ways that we can have more treatments for more people with the resources that we have. The second presentation will be about workforce development and training and how we can collaborate together in order to increase the number of skilled health workers, which can deliver the care that's needed in low resource areas.
So, in the context of your first presentation, what would be the main challenges that you can identify in the United States about access in radiotherapy? Because, for example, here in Chile, one of the main challenges that we face is that we don't have enough resources or maybe not enough equipment of radiotherapy, and most of them are centralized here in Santiago, which is the capital of the country. Does that happen in the United States, or do you have more equipment? How is the...
Yeah, even though we have a lot of equipment in some of our cities, we still face the same challenges that you face here. For example, I work at the University of Pennsylvania, which is in Philadelphia, and depending on which way you go from the university, if you lead left or right, there is about a 10-year difference in life expectancy, because there are some areas and neighborhoods that still have difficulties in getting access to care, even though they live minutes from an academic center like the University of Pennsylvania. So there are, we have a saying that's global health is local health. And some of the same things we learn from working with our partners around the world, we can apply to the same challenges that we have back at home.
And what are these things that you have learned from your partners that you can apply on your home, or that we can, as a country, apply here?
I think one of the most important things is that you have to involve the people. It's not just about doctors and scientists. It's about everyone is involved in this. And you have to really include them as part of the team. Because if you don't build that trust in the community, then most likely they may not go for screening, they may not go for treatment, or they may have a misunderstanding of what it means. And so you need to have that advocate. So for example, we work closely with churches because in community centers, because that's where people gather and that's where people have that level of trust. And so working with them in collaboration with what we're doing helps to increase that access to care and build that trust.
So the collaboration with the society, not just with the academics and the scientific areas.
Yes.
Yeah, we here in Chile we do basically the same thing. We kind of like to collaborate with all of the areas. Would it be the civil society, the scientific society, academics, and some of the instances that we make. For example, the symposium is a way to visualize, or just present radiotherapy to the world. Like, what would you like to acknowledge about this instance, about this event?
First of all, I think this is an amazing event because it's really powerful, because you're bringing together all of the societies and everyone is bringing their strengths and everyone for a common cause. And it's a partnership and collaboration. So I'm really excited about, this opportunity to speak here today. I know this has been an effort that's been going on for a few years. It's not anything new, but the fact that everyone has been brought together, everyone has a common goal, common mission to help each other. Each country has its own strengths. Each country has its own weaknesses. And I think together we can work to build the whole region up together.
And learn from one another.
Exactly, yes.
Thank you so much,
Thank
Doctor.
you. I appreciate it.